Shannon, and today I'll be talking about the link between diet, nutrition, and periodontal. So we should start by defining what a periodontium actually is. Your periodontium is the supporting tissues around the teeth. That includes the gingiva, which is more commonly known as the gums, the alveolar bone, which is the jawbone or the bone that the tooth actually sits in, and the periodontal ligaments, which are the ligaments that hold the tooth to the gums and the gums to the bone and so on. All of these are used to keep the tooth in place and keep it in a functional order. Periodontal disease is the inflammation of the periodontium. These diseases include gingivitis, which is very common. It's just swelling of the gums, and periodontitis, which is a more severe disease. It's less common, and with this disease there is attachment loss, there's alveolar bone loss, and there's decreased function of the tooth, and sometimes. So why would we want to keep a healthy periodontium? Destruction to the periodontium can lead to tooth mobility and eventually tooth loss if it is not treated by a professional and maintained through proper diet and nutrients as well as proper oral self-care. So to avoid these dentures, take your vitamins every day, brush and floss. So although a poor diet cannot cause periodontal disease, it can negatively affect the periodontium and its healing process, and it can definitely worsen an existing condition. Diets high in fermentable carbohydrates and sugars, things like white bread, they can often lower the pH in the oral cavity, making it more susceptible to bacteria growth and decay. So every time that you're sucking on, for example, hard candy, it lowers the pH in the oral cavity and it makes it more susceptible to that growth of the bacteria, and the bacteria is what causes the actual inflammation or the gingivitis and eventually periodontitis. So for good oral health, it's recommended that vitamin B complexes, vitamin C, vitamin D, and calcium are needed. So I'll just go over how vitamin B and vitamin C can cause a positive effect on the periodontium. So vitamin B complexes are used to maintain healthy blood and are necessary for cell growth and reproduction. They aid in regrowth and repair of the gingival tissues. Vitamin C is necessary to form the amino acids that form collagen. Collagen is used to keep the gums healthy and tightly fitted against the tooth. They also aid in the healing process and bone formation, therefore keeping the whole entire periodontium healthy. Next, we'll go over how vitamin D and calcium are important for bone health. So vitamin D and calcium are key in alveolar bone structure and stability. They aid in the attachment between the alveolar bone, the periodontal ligaments, and the teeth. In addition to this, vitamin D contains many antimicrobial agents to aid in minimizing the amount of bacteria that can cause these periodontal diseases. So calcium ensures that the bones are strong and that there's a stable connection between the tooth and the bone and the gums. And vitamin D aids in minimizing the amount of bacteria, meaning that periodontal disease is less. Periodontal disease treatment. This is often treated by a dental hygienist. So many people with existing periodontal disease link this disease or these bad teeth to bad experiences at the dentist, and therefore they don't seek care. So this becomes quite a cycle. They feel they have bad teeth, so they don't want to see the dentist because it's going to be a bad experience, and therefore their teeth get worse. A registered dental hygienist would perform a dietary analysis at a dental hygiene treatment. This dietary analysis can last up to 5 days, and you report exactly what you eat. The dental hygienist will then provide feedback to improve your diet, and this will improve your overall health, but also your periodontal health. It'll be based on Canada's food guide. They'll also instruct you on proper oral self-care, for example, brushing and flossing. So this would decrease the amount of bacteria in the mouth and decrease the chances of a periodontal disease occurring. And obviously, they would engage in debridement, that's cleaning of the actual tooth to promote the attachment and reduce the actual irritation and the swelling. So they would make recommendations based on Canada's food guide. So I've just taken some time to put together what servings of food the average male adult should consume according to Canada's food guide. So the average male should consume 8 to 10 servings of fruit and vegetables each day, 8 servings of grains daily, 2 servings of dairy each day, and 3 servings of meat daily. By consuming these recommended nutrients daily, higher immune function will prevent periodontal disease, and faster healing of an existing periodontal disease will occur. This is the goal of the dental hygienist when treating you. So what kind of food should you be eating? You should be eating milk and buttermilk, as well as raw fruits and vegetables. Try consuming plain yogurts, cheeses, and cottage cheese to get your dairy in. Hard-boiled eggs are a good source of protein. Nuts, sunflower seeds, and pumpkin seeds, as well as a good source of protein, are excellent at cleaning the actual teeth. Melba toast and salads are all. There are certain foods you should stay away from. Definitely hard candies. As stated before, they do lower the pH in the mouth every time. Sticky candies and fruit often stick in the teeth and can cause decay. Sports drinks are very high in sugar and can cause decay. Acidic foods, for example sucking on lemons, can cause erosion of the teeth. And sodas and fruit juices, again, are very high in sugar and can cause. So finally, I just want to finish up with some tips for a healthier periodontium. Avoid frequent snacking to limit the number of pH changes in the mouth, furthermore limiting decay. Consume the recommended nutrients daily to avoid exacerbating an existing periodontal condition and promote healing. This will also help maintain keeping your mouth healthy. Consider taking vitamin B complexes, vitamin C, vitamin D, and or calcium supplements if you know you're not able to get these through your diet. And definitely seek dental hygiene treatment on a regular basis, and especially if you notice any gingival swelling. It's important to brush every 12 hours and floss at least once every 24 hours to disturb the bacterial growth and minimize the chances of a periodontal disease occurring. That's all for now. Thank you very much.